I want to acknowledge on this phone call to, I'm not sure if he's with us here tonight, Omar Figueroa and Heather Burke and their contributions related to the small grower artisan language. And you mentioned a couple other points too there, Granddaddy, and there's a couple of calls that came in sequence, but Shona, I might want to, if you wouldn't mind, I'd like to bring you in here because you mentioned, Granddaddy, the different levels of growers and youths and whatnot. And Shona, if you don't mind, a question that's come in that's pretty important, and I know you assisted quite a bit in regards to the language for a long time related to this. And the question is very simple: is how is compassionate use addressed within the MCLR? Can you respond to that for us, Shona?
Sure. Granddaddy Mike did hit on one of the ways that compassionate use is addressed, and that is in the definition of a compassionate care provider, and being sort of a leveling of the playing field, so that if you are contributing a portion of your either your garden or from your dispensary, if you're providing a portion to people who have no way of making a gainful income, the disabled, the veterans, our folks in hospice care, that we level the playing field by taking out some of the registration fees, and it really enables these collectives to continue to exist. And they do exist. We have, the wonderful role model of WAM, Women's Alliance for Medical Marijuana. We have, a variety of compassionate services in San Francisco for folks, and we want to make sure that everyone that is taking the care is going to be able to exist on the map. We want to keep California compassionate. We want to not forget that the patients were who opened the gates for compassionate care, and we want to just make sure that there's equity in health care. This is health care, and, people who become disabled have a much harder time with having a gainful income and being able to purchase the amount and the quality of cannabis that they need. So one of the things that Berkeley does, and is also in our proposal, is it assures that the quality of the medicine is high. A lot of times, patients are in desperate need end up with sort of the what's swept up off the floor.